Let's look at what is the role of using estrogen in the luteal phase and seeing whether that improves the chances of pregnancy. So, what is the importance of estradiol in the follicular development? It's essentially evaluating follicular development during controlled ovarian hyperstimulation, and it indicates granular cell function. So, what is as soon as you see estrogen growing, it's not telling you whether there are eggs inside, it's telling you whether there is granular cell function as well as readiness of the endometrium for potential implantation, making it vital for treatment. What are the current controversies? The role of estradiol supplementation during luteal phase remains a subject of debate, and some studies suggest it may enhance implantation rates, while others indicate no significant improvement in clinical outcomes happen. So let's now look at this study. And what this study looked at is it aimed to evaluate whether addition of estradiol to progesterone during the luteal phase increases clinical pregnancy rates among patients undergoing ICSI cycles, particularly those with serum estradiol levels lower than expected. And so the general viewpoint was that if your estrogen is low, and often this is something which is asked, should I give estrogen in the luteal phase? Prospective single-blind randomized controlled trial involving 150 patients with defined criteria assigned to receive either oral estradiol with vaginal progesterone or progesterone alone during the luteal phase following the ICSI procedure. Inclusion criteria was women under 40 years, serum estradiol levels less than 100 picogram per ml per retirucide on a day of HCG administration, and they looked at BMI, basal FSH, and other factors. One received 4 milligram of oral estradiol along with 90 milligram of vaginal progesterone daily, while the other group received vaginal progesterone alone. This treatment continued till the pregnancy test or until the 8th week of gestation. So now let's look at the results. The, the study assessed clinical outcomes among 126 infertility patients undergoing ICSI. No significant difference was observed between the two treatment groups concerning implantation rates, clinical pregnancy rates, oral cycle rates, indicating the inclusion of estradiol may not enhance significantly women who have a low estrogen level. Again, a statistical analysis was done, and this I've just put it on to complete the data. And if you look at the pregnancy rates, they showed no statistical significant differences between progesterone only group at 28.6% and progesterone plus estradiol group at 31.7%. So, this lack of significance suggests that estradiol supplementation really does not influence the probability of pregnancy in women who have a low estrogen level. Again, sample size is small and study is design, and equally the variations that occur with estradiol supplementation doses constitutes a bias. This study concludes that the addition of 4 milligram oral estradiol to progesterone, again in women who had a low estrogen level during ICSI treatments, does not improve ICSI outcomes. In fact, you'll need more studies to be able to comprehensively prove this out. And so, in summary, we would say that if you do see a lower estradiol level, then really it doesn't see it doesn't tell you much about the egg. But I believe that as women get older, the glandular cells become less, and they are more likely to secrete a lower estrogen. And there, adding progesterone is the key because you're going to get lower progesterone levels. But adding estrogen really doesn't change it.